Climate change is one of the most pressing challenges of our time, affecting every aspect of life on Earth. But beyond melting glaciers and rising sea levels, there is another, often overlooked consequence: its profound impact on human health. How is our changing climate influencing the well-being of communities worldwide? And what can we do to protect ourselves? Understand the connection between climate change and health, we must first recognize that our environment and health are deeply intertwined. Climate change alters weather patterns, air quality, water availability, and ecosystems, all of which directly and indirectly influence human health. For instance, extreme weather events such as heat waves, hurricanes, and floods are becoming more frequent and severe, leading to injuries, deaths, and the displacement of millions. At the same time, shifting climates are affecting the distribution of diseases, with tropical illnesses like malaria and dengue spreading to new regions. Heat-related illnesses. Rising global temperatures are one of the most immediate and visible impacts of climate change. Heat waves are now more intense and prolonged, posing a serious risk to vulnerable populations such as the elderly, children, and those with pre-existing health conditions. Heat-related illnesses, including heat exhaustion and heat stroke, are on the rise. Additionally, higher temperatures exacerbate chronic conditions like cardiovascular and respiratory diseases. Cities, with their dense populations and heat-absorbing infrastructure, are particularly at risk, a phenomenon known as the urban heat island effect. Air quality and respiratory health. Climate change significantly affects air quality. Rising temperatures increase the frequency of wildfires, which release harmful pollutants into the air. Prolonged exposure to these pollutants can lead to respiratory issues such as asthma, bronchitis, and even long-term lung damage. Moreover, warmer temperatures accelerate the formation of ground-level ozone, a major component of smog. This poses additional risks to individuals with respiratory conditions, as well as children whose lungs are still developing. Waterborne and vector-borne diseasing. Weather patterns disrupt water systems, leading to both droughts and floods. Flooding can contaminate drinking water supplies, spreading waterborne diseases such as cholera and typhoid. On the other hand, droughts reduce access to clean water, compounding hygiene and sanitation challenges. Vector-borne diseases are also on the rise. Warmer climates and shifting rainfall patterns create ideal breeding conditions for mosquitoes, ticks, and other disease carriers. Diseases like malaria, dengue fever, and Lyme disease are spreading to regions previously unaffected, putting new populations at risk. Mental health impacts. Mental health effects of climate change are profound, yet often underreported. Natural disasters, displacement, and the loss of livelihoods contribute to stress, anxiety, and depression. The term eco-anxiety has emerged to describe the chronic fear of environmental doom, particularly among younger generations. Communities affected by extreme weather events face long-term psychological impacts, including post-traumatic stress disorder (PTSD). Addressing these mental health challenges requires integrating psychological support into disaster response and recovery efforts. Food security and nutrition. Climate change disrupts agricultural systems, threatening global food security. Changes in temperature, precipitation, and the frequency of extreme weather events affect crop yields and livestock production. As a result, malnutrition and food shortages are becoming more prevalent, particularly in vulnerable regions. Additionally, higher carbon dioxide levels can reduce the nutritional quality of staple crops like wheat and rice, exacerbating hidden hunger by diminishing essential nutrients such as protein, iron, and zinc. Global disparities. While climate change affects everyone, its health impacts are not evenly distributed. Low-income communities, indigenous populations, and those in developing countries often bear the brunt of climate-related health challenges. Limited access to healthcare, poor infrastructure, and high dependence on natural resources make these groups especially vulnerable. Efforts to address climate change and health disparities must prioritize equity, ensuring that the most affected populations receive the support they need. This includes strengthening healthcare systems, building resilient infrastructure, and empowering communities to adapt. Solutions and adaptation. The intersection of climate change and health demands urgent action. Governments, organizations, and individuals all have roles to play in mitigating these impacts. Key strategies include transitioning to renewable energy sources to reduce greenhouse gas emissions, investing in climate-resilient healthcare systems to better respond to emerging health threats, enhancing early warning systems for extreme weather events and disease outbreaks, promoting sustainable agricultural practices to ensure food security, educating the public about the health risks of climate change and how to mitigate them. Climate change is not just an environmental issue, it is a health crisis that affects us all. By addressing its root causes and adapting to its impacts, we can protect the health and well-being of current and future generations. The choices we make today will shape the world we live in tomorrow. Together, we can create a healthier, more resilient future for all.